Hi, my name is Patrick Lequette and I'm your nursing school tutor. Today we're going to be talking about adrenal cortex disorders. So a little recap on your anatomy in regards to that is the adrenal cortex is this little top hat that sits right on top of your kidneys. So think of that both your kidneys have these tiny little top hats, and what we want to focus on what it's secreting today is what we call glucocorticoids, mineralocorticoids, and sex hormones. So those glucocorticoids, mineralocorticoids, if you hear the medication corticosteroids, that's exactly what I want you to think about, steroids. Now, the best way for you to remember this is you heard steroids in another outside context, which is your bodybuilders, right? They use steroids a lot. So I want you to kind of picture that same kind of steroid as well. So let's take a look at what it affects. So today we're going to be talking about two specific types of diseases for nursing. It's going to be your Cushing's versus Addison's disease. Cushing's disease versus Addison's disease. So the way you remember which one's which is that Cushing's has too much steroids. And the way you kind of get around with the wording is bodybuilders, when they take steroids, they have a lot of cushion, right? They have a lot of cushion. They're buff. So you're going to be thinking Cushing, too much steroid. They're puffy, they're buff. Addison's would be, we need to add more steroids. Addison's, because they don't have enough steroids. Again, Cushing's, you have cushion, you have too much steroids. Addison, you need to add more steroids because there's not enough. Okay. Now, let's focus on Cushing's first, right? Too much steroids. So if we think about what your bodybuilders go through when they have too much steroids, right? They gain a lot of weight. Think about that. They gain a lot of weight. So let's start off with basically what can cause this. Of course, if there's something wrong with the adrenal gland, this can cause an excess in secretion of steroids, right? Basically overuse of cortisol medication or excessive steroid use. Now, for the sign and symptom, I want you to think of that excessive weight gain. Again, bodybuilders, they gain a lot of weight. But the difference with this is your bodybuilders, they use those steroids and they actually work out and they gain weight. But what happens if a normal person just starts using steroids and doesn't do anything about it, right? So instead of basically gaining that muscle, they're going to gain fat. And if you look at it, so know these classic symptoms. When I say classic symptoms, when you hear this on your NCLEX, you pick it for this disease, right? That buffalo hump, it's that fatty pad on the back that creates that buffalo hump. Truncal obesity means basically they're gaining weight in the trunk. And if you know anything with cortisol, that makes you gain abdominal fat, right? And they have thin arms because they're gaining all that weight right in the middle. There's muscle wasting because they're not bodybuilders. They're going to waste that muscle. There's supraclavicular fat pads. Now, just think your clavicle. Supra means above. So right above the clavicle, there's going to be fat tissue. If you feel your clavicle right now, it should not have any fat tissue whatsoever. It's like a little dip. But with these individuals, they're going to have that fat accumulating in those areas. Moon face, right? They form a nice little shape of a moon, right? That half moon right there, that's what they're forming. And of course, your bodybuilders, the more they take their steroids, the more manlier they become. The more manlier they become, the more testosterone, the more facial hair. That's hirsutism, and they have masculine features. Now, when we talk about steroids, I want you to remember that two things go up, two things go down. I teach my students this all the time. Two things go up in lab values, two things go down in lab values. Glucose, blood sugar goes up, right? Your bodybuilders have a spike in their blood sugar, and that's how they gain that muscle, gain that weight. Now, sodium goes up, and that's what's causing the weight gain because sodium follows water, right? They're retaining more water, they're gaining more weight. Sodium and potassium are inverse to each other. So when sodium goes up, potassium goes down. Sodium goes down, potassium goes up. So automatically you should know that when sodium goes up, potassium is low. And lastly, I want you to remember that the more steroids, right, the more chronic the steroid use, the more risk for osteoporosis. So lower calcium levels. Again, two things go up, two things go down. Glucose and sodium goes up, potassium and calcium levels go down. And as you know, with high sodium, that's one risk factor for causing what we call hypertension. high blood pressure. Okay? So how do we fix this? Number one, let's take out the adrenal gland, right? Let's take out the adrenal gland. Now, the problem with taking out the adrenal gland is now, are we producing steroids? Not at all. We send them down to basically the state of basically Addison's, right? Not enough steroids. So that's the risk that we want to avoid there. So we'll address that in the next topic. Also, if it is a tumor, we want to think chemotherapeutic agents, right? We want to think chemotherapy. We want to think cancer, okay? Now, another cause for this is the pituitary gland is what secretes that triggers the adrenal gland. They might do basically surgery on that area as well. So one thing you want to teach your patients that have adrenalectomies is they're not going to be producing steroids. They will have to take steroid medication, which is going to be what we call corticosteroids at this point. Now, let's talk the other form of the disease, the other end of that spectrum. You're not producing enough steroids. So we need to add Addison's, right? We need to add steroids. Now, what can cause this? We already talked about one, adrenalectomy, right? In Cushing's, we remove the adrenal gland, but in doing so, we can send them into a state of Addison's disease. Okay. Another cause of this is that there's an infection in the adrenal gland, right? It could basically, if there's an infection, you're decreasing the function of that adrenal gland. And of course, we're not producing the steroid. We're not doing what we're supposed to do. And these are the types of infections they can get. Okay? So we're not going to address that too much. We're going to jump in right to the sign and symptom and what you need to know. Now, because your bodybuilders, they have Cushing, they're energetic, they're just, ready to go. Now think of the opposite end. They're going to be tired, they're fatigued, right? They're not gaining fat or muscle, they're anorexic, right? So another effect is nausea, vomiting, diarrhea. We have those GI symptoms. But one thing I would like for you to kind of note is the lab values. We talk with your Cushing's that 2 things go up, 2 things go down. We're reversing that. In Cushing's, blood sugar, sodium goes up, potassium and calcium goes down. In Addison's, we're going to reverse that. Your blood sugar and your sodium are going to go down, right? Blood sugar, sodium going to go down, and basically your potassium goes up. Calcium, we're not touching that, doesn't really affect it. There's no gain in calcium whatsoever, right? So one thing we want to take a look at is because our sodium is low, there is no hold to water. What happens to your blood pressure? So your sodium's low, we cannot hold on to water. What happens to that blood pressure? Your blood vessels and there's no volume in there. So hypotension, low blood pressure. And that's one thing I want you to make a note of is the low blood pressure. That's the one thing that we really need to worry about in your Addison's, okay? Confusion because of that hypovolemic state again. And one classic sign, right? One classic sign with Addison you're going to look for is the vitiligo, white areas of depigmentation. Basically what Michael Jackson had, right? The whitening of the areas. So that's one thing that's classic to that disease. Now, with Addison's, we gotta be concerned about one thing. And that is an Addisonian crisis. We cannot live in a state without steroid at all. Without steroids, basically, we lose a certain function in life, right? We need that on a daily basis to be produced. Now, without the cortisol, without that steroid, we head into what we call Addisonian crisis. Easiest way for you to remember that is every single sign and symptom here, multiply it tenfold. Multiply that by 10, right? Extremely fatigued, extremely hypovolemic, extremely low blood pressure, very low sugar, everything's just failing, right? Basically low sodium. The potassium is going up, which can cause a lot of cardiac dysrhythmias. But the main thing we got to watch out for, A, B, C, right? Your hypovolemia, that is your C, that is your circulation, that is your priority, right? So we basically, what do we need to do? Replace that volume, right? Replace that volume. We got to give fluid. And we're going to talk IV fluid here, not just take a sip of water. We're going to give IV fluid. And of course, to be able to all hold that in, we got to give that steroid, that hydrocortisone, corticosteroid, whatever we need, whatever kind of steroids needed, right? So how do we treat this, right? Give the steroid. And of course, because they are anorexic, we got to fix that malnourishment. High protein, high carbs, we got to get them in a state where, hey, your Cushing's your bodybuilder, but your Addison's, this is your anorexic person. We got to fix that malnourishment, right? So let's take a look at both of them combined. Let's take a look at both of them combined. Now, one thing I would like to add about Addison's, if they're getting replaced with their steroids, one thing to note down is that in the periods of stress, when they're hospitalized, there's an infection, they need to talk to their provider that they may need to increase their corticosteroids, their steroid treatment, right? So that's one thing you want to note down. That is an NCLEX point of topic. It might be asked in NCLEX or your HESI or your exit exams. So let's take a look at Cushing's and Addison side by side. Again, the way you remember it, right? Cushing's and Addison, it's a steroid problem. Cushing, your bodybuilder, has a lot of cushion, too much steroids. Your Addison, low steroids, we need to add some steroids, right? So causes, right? Causes, it's both a problem directly with the adrenal gland. Your Cushing's could be a tumor, right? Overuse, we took too much steroids, bodybuilders or someone just taking steroids constantly. Or on the Addison's portion, it's an infection. There's a problem with the adrenal. Sign and symptom for Cushing's, know your classic signs. The buffalo hump, the moon face, the fat pads, right? The supraclavicular fat pads, truncal obesity. If you hear those on NCLEX, that's classic. You're not going to hear those much elsewhere with other diseases. In nursing, those are what you're going to hear. Now, weight gain, steroid use, very masculine, right? Hirsutism, that is your facial hair. Now, labs, Cushing's, glucose up, sodium up, potassium down, calcium down. Again, glucose up because we need to build that muscle because of steroids, sodium up, right? Potassium down, calcium down. So when you think sodium, think hypertension as well. High sodium means they get hypertensive. And what do we do for that? Take it off. Adrenalectomy. Take that adrenal gland off. Don't get any infection. And maybe we need to get chemotherapy or radiation. Now, someone got adrenalectomy. We don't have an adrenal gland. We are not producing steroids, which could send us into Addison's. Addison's, we need to add some steroids. So what do we do about that, right? Basically, we know the causes. So what are signs and symptoms? Think opposite of your Cushing's. Instead of having that cushion, we're going to be anorexic, right? Instead of having that energy, we're going to be very tired. Lab values, the two things that went up in Cushing's, it's going to go down. Low glucose, low sodium, potassium's high, calcium, don't even worry about it right now, all right? Because sodium is low, water follows as well. There is no volume. Blood pressure is your problem. Hypotension, hypovolemia. The vitiligo, of course. And in times of an emergency, that's your Addison's crisis. Just multiply this by 10, right? And our biggest problem is your ABC, that fluid resuscitation, that hypovolemia. It's what's going to kill them, right? We can't live with a very low blood pressure. Now we got to give that IV fluid and replace those steroids. And of course, we got to fix that anorexia with the proteins and the carbs. So again, with the steroid use they're going to have, with the steroid treatment plan, they need to be on this lifelong, right? They need to be on this lifelong, and they need to increase per their providers' orders. They need to be increasing this in times of stress and infection. All right, that's it for this section on endocrine. Follow me for more.